Hello everyone, so quick video. We're going to talk about what is osteopathy. Sue asked me to do this video. Those of you who know Sue know she's a force to be reckoned with and not to mess with her, so I'm being a good boy and doing as I'm told. So, what is osteopathy? So I once asked this question at university and someone told me and I was told the answer is whatever an osteopath does, but I think that's a bit of a cop-out. So it's a question we get asked frequently, so I thought I'd take the time to address it. Osteopathy is the treatment of injury or pain or dysfunction within the body, and we assist the body to get it back to a neutral position and stop or reduce that pain or discomfort that you as the patient are suffering. So most osteopaths will say to you that we don't cure the problem, we assist the body in healing itself. We put it back in a position where it can heal itself. Osteopathy works in lots of different ways, and I'm going to talk a little bit about sort of structural osteopathy today and how we deal with the body structurally. So we'll work on a variety of different areas, looking at the body as a whole to bring it back into working as a full unit. If you think of the body as a chain, if you have a kink in a chain, it's not going to run smoothly. So what we do is we mobilise that kink out, get it moving better so the whole chain can run smoothly. So a kink in one part of the chain can have an effect at another part of the chain, and this happens in the human body as well. So we work on several different areas. One of the things that we work on is what we call soft tissues. Now, soft tissues are not these. No. Soft tissues are what we talk about we're talking about muscle, ligament, tendon, and fascia as well. And for those of you who don't know what fascia is the connective tissue that holds everything together. So when you buy a bit of meat from the butcher's, it's that white, tough tissue, and that holds everything together. So we work on them using things like massages and stretching, and we'll give you home stretching exercises and muscle strengthening exercises. We're looking to increase blood flow to damage ligaments and tendons because their blood supply is poorer, and the blood is where the body heals itself. So that's that side of what osteopaths do on the soft tissues. Then you've got the side of things like joints. So if there's a joint restriction, we'll look at increasing the mobility of that joint, getting it to what should be the range of movement that we'd expect. So we use things like mobilisations, again home exercises, and to get you moving that area. We use manipulations if it's deemed safe and if it's necessary. They're a very good way of getting joint movement back quite quickly. And manipulations also have an effect on the soft tissues, because if we've got an impingement, say a spinal level, that can cause compression on a nerve. Nerve supply to the muscles can cause muscle spasm. So by manipulating the joint, we can decrease the compression at the nerve and get the muscle tension reduced. So osteopathy is a sort of hands-on manual therapy that looks at the body as a whole, and we don't just look at the area where you've got pain. We look above and below that area to work out, the pain's the symptom, we want to know what the cause of the pain is. So that's really, to me, and my view on what osteopathy is and why and how I practice mainly as an osteopath. There is a lot more. People will have different views on it, and they'll work in slightly different ways to what I do. But I think that's probably a nice little introduction to what osteopathy is. Gives you an idea of, if you came to see one of us here, how we would work. If you've got any more questions, you can put them below, and we'll do our best to answer them. So that is what is osteopathy. So. That was Sue.
Sorry, you
No.
and I've got my wrong glasses on, do you mind? That looks